Yeah, in this practice changing study, the CheckMate 274, that evaluated for the first time an adjuvant immunotherapy with nivolumab as compared to placebo in patients with high-risk muscle-invasive urothelial cancer after radical resection, providing for the first time a newer standard of care in the FDA and the EMA approval as nivolumab in this adjuvant setting, of course. The development of biomarker body of knowledge is still at its infancy, and we have presented today the data on the first biomarkers that are emerging from this study, looking in particular at the gene expression signature, at the tumor mutational burden, at the PD-L1 expression, so the typical biomarkers that have been associated with immunotherapy benefit in patients with advanced urothelial cancer, or which are linked to the evidence of pre-existing anti-tumor immunity in these patients. The data, the summary of the data, basically is that there was a strong association between interferon-γ gene signature and the CD4 gene expression in association with disease-free survival, and this association was associated with the nivolumab arm, with the treatment effect. So there was a strong predictive value also of CD4 interferon-γ signature score in relation to the disease-free survival outcomes of these patients. Additional data we have presented related to the TMB and related to the CD4 point to the role of these biomarkers as associated with disease-free survival, with the weaker evidence of treatment effect according to these biomarkers. So there is, of course, a prognostic value and a weaker effect on the predictive value of these biomarkers. But of course, we are still at the beginning, and the point is how to best integrate these biomarkers, in particular to integrate with the PD-L1 expression, in order to see whether we can further improve in the real world the translation of and the selection of patients in real world who may benefit the most from adjuvant nivolumab.